start up now. As you know, we have to Diana and other named quarters 5 of PhD lecture. And that's what I'll welcome you. And then we have the committee. And first, Professor Per Alström from Stockholm School of Business. And then Associate Professor Kim Sundholt-Hall from Copenhagen Business School. And finally, one of our own, Lars Lang from our department. And that's where we have also the supervisor, Peter Jacobsen, there. And I'm chairman for this session, and my name is Jørgen Lindgaard Petersen. I'm associate professor of the department. My most important job these days will always be to be chairman at PhD. I think you shall think about that. The title of the thesis is Improving Healthcare Logistics Processes. And as you know, you have 45 minutes, and I am sure that you will take 45 minutes plus minus 1 minute. And then the floor is yours.
Thank you very much, Jørgen. Thank you very much, everybody, for being here today to my defense. And of course, a special thank you to the assessment committee, who has also taken the time to read my thesis. Now, today I'm going to present the PhD project that I have been working on for the past 3 years. So I probably won't be able to cover everything I did in the thesis, but I will try to cover the main points of my findings. So the agenda for today is, first of all, I will provide a motivation for conducting this study. Then I will talk a bit about the theoretical background of this research project. Then I will move on to explaining the method. Then we will have a deep dive case example to give you an idea of what it is that I have been working with over the past 3 years. And then I will provide some results and conclusions and end off with some contributions and practical implications. So first of all, why is this study interesting at all? Well, the cost of providing healthcare has been rising over the years. So this is due to a number of factors. For example, now we have more sophisticated treatments, we have more sophisticated medicine, we have more sophisticated technologies in our hospitals. So all of this adds up to rising healthcare costs. At the same time, we also have an aging population. So people have more chronic diseases as they become older and need more medical attention. So all of this also adds up to the cost of providing healthcare. And finally, we have very high expectations to the quality of care that is provided for us. So together, these all contribute to rising healthcare costs. If we then look at the Danish healthcare system and the US healthcare system, which I have been looking at in my studies, they both have an incentive to reduce these costs. So if we look at the Danish healthcare system, for example, throughout the 1970s, we had these reforms due to a rising critique of inefficiencies in the public sector, including the healthcare sector. So this led to reforms. Most recently, in 2007, we had a reform that introduced these 5 regions across Denmark. So each of these regions are responsible for the administration of hospitals. Each region then is expected to deliver a 2% productivity increase. And this productivity increase, in effect, means that there's a 2% budget cut each year, and at the same time, hospitals are expected to deliver the same outcome. In Denmark, a lot of hospitals are being built, and they're refurbishing the hospitals, which also costs a lot of money. And the idea is to be able to provide better healthcare. We've also introduced digital platforms in 2 of the regions, also to improve the healthcare provided. So at the same time as costs are increasing, there's also an incentive for reducing these costs in the Danish healthcare system. If we then move on to the US healthcare system, well, this is the most expensive healthcare model in the world, and it's funded by mainly private insurance. So the expenditure of healthcare per capita is much larger than for any other country. In 2010, the Affordable Care Act was signed into law to ensure affordable care to all Americans. However, this has partly been repealed in 2017 by the current administration. But this is just to say that there has been incentives and motivations to reduce cost of healthcare. If we then look at costs in a hospital, 30% or more of the costs in a hospital relate to healthcare logistics activities. Studies show that about half of these costs could be eliminated by introducing best practices in hospitals. So this means that looking at logistical processes in hospitals, there is a huge potential for reducing these costs. However, if we look at logistical processes at all in hospitals, hospitals face a very complex environment. So, for example, there's a lot of uncertainty and unpredictability in a hospital. You don't necessarily know how many patients you're getting in or what their ailments are. There's also a lot of different organizational units in the hospital and a lot of different staff groups. So this means that all of these staff groups have to work together, which also makes it more complicated. And finally, we have a lot of unique and interrelated processes in hospitals, which makes it very difficult to manage. And finally, everything depends, or lives depends on these processes and the ability to provide healthcare. So there is also a sense of acuity and criticality in this environment. So together, this all provides a very complicated environment, which makes it perhaps difficult to apply a process approach. Hospitals have been turning to these management tools, which you usually see in the manufacturing industry. So this could be, for example, business process reengineering, Six Sigma, or Lean. However, given these very complex circumstances, how do you make these approaches function in a hospital, and which ones are most suitable in such a very complex setting? So if you look at literature, it doesn't really provide much guidance. Some say that operations in hospitals are equivalent to that of the automotive industry in the 80s and 90s. There's also often not a lot of clarity about how you can develop your supply chain strategies, and often in implementing these management approaches, hospitals don't really reach the operational goals that they have set out. So often these managers must rely on their own sort of experiences and judgment to figure out how can we make this work in a hospital setting. So that is why the aim of this research is to provide theoretically and empirically based evidence for improving healthcare logistics processes. And this is both to expand the knowledge base, but also to provide help to these managers in hospitals to improve their processes. So to do this, an overall research question was posed. And the question is, how can hospitals improve the logistical processes to ensure that the process design and performance fit the needs and preferences of a hospital? Now, what is really important to remember here is the context in which the hospital operates. So what is important for one hospital with certain medical specialties might not be as important for other medical hospitals with other specialties. So you could replace the words needs and preferences with perhaps the context of a hospital. But the reason for this wording, preferences, is that one of the assessment methods that was used in this study is based on the preferences of the decision maker. To focus this overall research question, 3 underlying research questions were posed. So the first research question is quite descriptive. If you want to improve something, in this case, healthcare logistics processes, you really need to know what it is that you're dealing with. So that is why the first research question has to do with how can you characterize these processes and what are the design elements in them. If you then have made the decision that you want to improve your processes, then what are the different aspects that you should consider as a decision maker? And that's what the second research question is about. If we then have these different interventions or solutions that you might want to introduce, how can you then assess these many interventions or possible solutions to figure out what is right in your situation? So that's what the third research question is about. As this is an article-based PhD, 7 papers were produced as part of this project. 4 journal papers, of which 2 have been published, and 3 conference papers. Now, each of these papers then contribute to answering the overall research questions. And this can be seen as sort of a hierarchy of questions. So first we have the meta-research question on the left, as I mentioned before, and then the 3 underlying research questions. These research questions can then be divided into 8 sub-questions. So they each answer the research questions. If we then relate it to the papers that have been produced, well, these papers all feed into answering the sub-questions. They're either alterations or a variation of the sub-questions or sub-questions to the sub-questions. So I don't expect you to be able to make out what this slide actually says, but it's just to give you an idea about how each paper feeds into answering the questions. So now I'm going to talk a bit about the theoretical foundation of this study. So first of all, we need to establish what it is we're talking about here. So we're mainly talking about materials flows. We're not really talking about patient flows here. And these material flows are handled by logistical processes. These logistical processes all take place within the hospital. So we're talking about logistical processes within the confines of a hospital and not so much the domain outside of the hospital. The outside domain has been included to some extent, but the confines of the hospital is the main framing of it. To sort of establish the state of the research field, a systematic literature review was conducted. So 81 papers were reviewed in this analysis, and these papers were published between 1992 and 2016. And as you can see on this left graph, there's sort of a low level of publications until a peak in 2013, and then there's the decline again. So there hasn't been an increasing number of papers published. Most of the papers or the studies were conducted in North America and in Europe. If we then look at where were these papers published, then they're published across a wide variety of journals, so 60 journals. There's not 1 or 2 journals which have mainly published these papers, so they're quite disparate across, or dispersed across these journals. Also, case study has been the most prevalent method, which is a more exploratory method, perhaps. So this indicates that given these very low levels of publications, the dispersed journals that we see the papers published in, and the more exploratory case study research used, this indicates that this is an emerging field and that is quite a new research field. If we then dive into the content of the papers, we can see that each paper considers 4 different types, or 1 or more of 4 different types of interventions. So these interventions either relate to logistics and supply chain management, technological interventions, business process management, or organizational interventions. So an intervention is some kind of deliberate attempt to improve your process by introducing, for example, just-in-time or barcodes or performance measurement in your process. So if we look at this graph, each of these colored blocks represent the vastness of literature in that field. So as we can see, logistics and supply chain management is the most investigated field. Technological intervention is also quite investigated. less so is business process management, and least investigated is organizational interventions. So this is also where the bulk of the opportunities for future research lies. If we then look at how many themes each of these papers covers, then you can see we have here BPM, logistics, organization, and technology. So 10 of the papers cover all 4 themes. 3 of the papers cover logistics, organization, and technology. 8 of the papers cover technology, BPM, and logistics, and so on and so forth. So this really indicates that it's a very interdisciplinary field, and most papers will cover more than one theme. You can also see here again how BPM and organizational literature is the least investigated field. So where does this study contribute to? It sort of contributes to all 4 literature streams, so business process management and logistics. For technological interventions, it's mostly in terms of technology assessment and justification. And if we look at the organizational aspects, it's mainly the human factors. So if you then dive in to see where the specific contributions to these research themes, then again, the contributions lie in all 4 themes because the framework is developed that can assess all of these interventions regardless of where they fit into. In terms of business process management, then some metrics are provided and some discussions are provided on how you can capture data. The processes are also characterized for different types of processes in a healthcare logistics setting, and the challenges are identified for these processes. If you look at logistics, then the papers also discuss how you can integrate your internal supply chain. And in terms of organizational interventions, the papers stress the importance of people and skills in terms of providing high quality care. So which methods did I apply during this research project? Well, the state of the research field really determines what type of research you can conduct. So if we look at the healthcare research field or healthcare logistics research field, it lies somewhere in between nascent theory and intermediate theory. So some research has been done, but not a lot. So it lies towards exploratory and descriptive research, but also a bit towards explanatory and prescriptive research. So what type of research can you conduct for such a research field? So this study lies mainly within theory building, but a bit towards exploration. So the first research question is somewhat exploratory and descriptive, and moving towards theory testing, also in terms of having different cases across country settings and across different types of processes. If we then look at what methods can be applied for such a research field, then within theory building, it's mainly few-focused case studies, in-depth field case studies, multi-site case studies, and best-in-class case studies. So this is what was done in this project. It also leans a bit toward exploration in terms of in-depth case studies, and also a bit toward theory testing in terms of multiple case studies. So let's look at the case studies that were conducted. Case studies were conducted in both a Danish and US setting. So 5 case hospitals were investigated in a Danish setting, all public hospitals within the capital region of Denmark. They range between small and large hospitals, and each hospital has its own medical specialty. If we then look at the US case hospital, 1 hospital was investigated. It's a non-profit hospital. It's quite large with 1,250 beds. It's part of a larger hospital system with hospitals in the US and abroad. The hospital offers all medical specialties, and it is considered a top-ranking hospital in the US. If we then compare the individual hospitals, then here we can see how the Danish hospitals range between 250 beds up to large hospitals with 700 beds. By comparison, the US hospital is quite big with 1,250 beds. All hospitals have a 24-hour emergency department apart from 2 of the Danish hospitals. So in this study, 3 different process types were investigated. First of all, the bed logistics process was investigated. So this concerns the flow of the bed in a hospital and not so much the patient. Also, the hospital cleaning process was investigated. So this is the distribution of cleaning staff to perform cleaning tasks around the hospital. And finally, the pharmaceutical distribution process was investigated, which has to do with distributing and stocking pharmaceutical products. So for the bed logistics process, a multiple case study was conducted in Denmark of 5 hospitals. One case study was conducted in the US hospital. For the hospital cleaning process, one study was conducted in Denmark. A separate study was not conducted for the US hospital, but it was sort of part of the bed logistics process. The pharmaceutical distribution process was investigated for 1 hospital in Denmark and 1 hospital in the US. And the US hospital was kind of expected to be the best-in-class hospital. So data was collected through 60 interviews, 24 observation sessions, 39 documents were gathered, and sort of a mini-survey was conducted. And here you can see how data collection is distributed across the different case studies. The nature of the data that was gathered is both qualitative and quantitative. So a mixed methods approach was applied. It's mainly a qualitative approach, so beginning off with the qualitative approach and with most of the data being qualitative and exhibiting or making an extensive analysis of the qualitative data. Then moving on to the less dominant approach, which was the quantitative approach with more limited data and perhaps simpler methods applied. So the strength of using this mixed methods approach is that the methods are complementary. You can address more complex research questions, and you can triangulate across methods and data types. If we then look at the constructs that were investigated for this study, well, on the one hand, you have these interventions which relate to procedures, logistics, technology, or organization. So this could again be just in time, performance measurement, and so on. Then on the other hand, you have the decision to change your healthcare logistics process design by introducing one of these interventions to hopefully improve your process. And then in between, you have these impact factors which influence the decision to introduce one of these interventions or not to improve your process. To identify these impact factors, which are the focus of this study, then 3 fundamental questions were posed, which is really rephrasing the structure of what is an impact factor in this process. So first of all, identifying what are the challenges in a healthcare process. So what are the challenges that decision makers want to overcome by introducing any of these interventions? Then, if you have introduced any of these interventions, what are the underlying reasons for doing so? And finally, in the decision process, how did you decide to go for this intervention? What types of decision criteria did you use? So how were these impact factors identified? They were identified in the qualitative data. So imagine that each of these black dots represents a data point or an observation in the study. So it could be snippets of interviews or an observation made or something read in a document. So each of these data points relate to either challenges, or they relate to decision criteria, or they relate to the reasons behind implementing either of these interventions. Then some common themes will emerge across these data points. And these are the impact factors, so the factors that impact your decision. So these could relate to one or more of each of these categories. Each impact factor can then be related to either technology, logistics, procedure, or structure. So these are the impact factors that were identified. If we move from the qualitative data to the quantitative data and data analysis, then we have some basic statistics in terms of averages and standard deviations. We also have a method applied, which is the analytic network process. So what this method does is that it allows for a pairwise comparison of parameters. And this method assumes that it's more easy for a human being to say, this parameter is twice as important as this other parameter, rather than having to rank 10 different parameters at a time. So what this does is that it allows for ranking of these parameters and different solutions based on the preferences of the decision maker. So now that you have an idea of how data was gathered, let's have a look at what data was actually gathered. So this is to give you an idea of what a logistical healthcare process is, what challenges are posed in such a process, and what are the different interventions that they could have implemented. So the deep dive case that I have chosen is the case of the pharmaceutical distribution process in the US, which I find to be the most interesting one. At the top, you can see the map of the process in the US, and in the bottom, you can see how the Danish process is mapped out. So as you can see, the US process is much more complicated than the Danish process. It also contains a lot more technologies than the Danish process, which makes it quite interesting. So let's have a look at what the challenges are in such a pharmaceutical process. Well, first of all, we have shortages in supplies of pharmaceuticals. So this is not just an issue in the US, but across many countries with different income levels. They also have an issue of stock count accuracy. So even though they have implemented barcodes, they still need to count the central and local stocks every 2 weeks to make sure that what the barcodes have counted is actually correct. And this is because items are automatically reordered. So you really need to make sure that these stocks are counted correctly. Then there's also a very strong continuous improvement culture in this hospital. And that means that there's a difficulty in coping with the need for continuous education. Also, compared to the Danish process, which has almost no data, the US process has a lot of data, and almost so much data that they don't know what to do with it. So how can they utilize this data to make sure that you can optimize your process, your inventory levels, your inventory mix, and so on? In terms of organization, there's also a huge issue with employee turnover and absenteeism. So how do you keep these people engaged? And finally, maintenance of technologies. So this hospital is huge, and there's a lot of technologies in the local wards. So how can you maintain these technologies properly over such a vast area? So all these challenges feed into the impact factors that were identified. So the other aspect of it was these interventions that were implemented. So if you can look at the process of the pharmaceutical distribution process, you can see the map here. And they had introduced different technologies to sort of improve their process. So the first thing that they had introduced were these barcodes. So at this 5 points in time in the process, they had implemented barcodes to make sure that the right number and the right items were delivered to the next process step. It also allows for analytics, so you can improve the flow of the process. And it's especially important in terms of administering the right drugs to the right patient. Another technology that was introduced were the AGVs, so the automated guided vehicles. So these allow for automatic transport, and the reason that these were introduced was that, well, partly you could automate your transportation, you had less injuries for transporters, and also robots never get sick. So they don't have a day off. Of course, they will need maintenance, but yeah, basically they're working 24/7. They also introduced these semi-automated picking carousels. So these picking carousels help the operator pick the exact amount and the right item to be delivered in the wards. The reason they chose this semi-automated solution was that it was less expensive than a fully automated solution. It took up less space, so it's not a manufacturing site. You don't have a lot of space. And it's also more flexible in terms of capacity. Another transport intervention that they had introduced were the pneumatic tubes. So these allowed for more flexible transport of small deliveries to the wards. And finally, they had introduced pharmaceutical dispensing stations in the wards. So this allowed for the hospital to keep very close control of what was going in and out of these wards' inventories. And that's particularly important for narcotics. So only certain people would have access to these narcotics, and you would always know who the narcotics were given to. And also, such systems allows for analytics and for analyzing, do you have the right inventory levels and do you have the right inventory mix? So now that you have an idea of the type of data that was gathered and what a logistical process could be, then I'm going to move on to the results and the conclusions. So in answering the first research question, part of this was, what are the challenges in a hospital logistics process? So some challenges were identified in literature, and some challenges were identified in the case studies. And also there is an overlap, so some of the challenges were identified in both. So if you look at the literature, for example, one of the challenges was overstocking of items, which is quite expensive. There's also the issue of special handling of items, particularly drugs and blood products, for example. There's also a certain unpredictability and uncertainty and all of this complexity in the process. And this is also made more complex by the many different political agendas you will find in a hospital. So looking at case studies, performance measurement and data capturing was especially an issue or a challenge for the Danish hospitals. So they didn't really have a lot of data, and it was really difficult to measure performance. There are also certain physical constraints. It's not a manufacturing site, so they do have to sort of operate within these physical boundaries. It's also a problem to locate where your people are and where your items are, especially for the Danish processes. And in terms of organization, again, a huge issue was to engage your employees. So how do you make sure to retain your employees and to make sure that they actually meet up for work? So some of the common challenges that were identified were these inefficient processes that you might find in hospitals, also due to this immaturity of the processes. They're often very manual and you can't get a lot of data. There's also an issue of balancing quality and cost. So with what you have, how can you provide the best quality possible? And finally, to integrate your supply chain and make a seamless supply chain in the hospital, how do you integrate with your supplier systems? So the other aspect of the first research question, what are the design elements? So what are the different interventions that have been introduced? Again, we have these 4 major themes, and these are all the interventions that were identified in the case studies and in literature. Now, I won't be able to go through all of them, but perhaps a couple of them would be worth mentioning. So, for example, performance measurement and benchmarking, which a lot of my study had to do with, considers how can you measure performance for such processes and how can you benchmark and compare them to other processes. Control measures at handovers, for example, by implementing these barcodes, also turned out to be quite important. So how do you make sure that you don't have a mistake that is moved to the next process step? And finally, continuous improvement. The whole idea behind this is very important to continuously make your processes better. In terms of logistics, a lot of it had to do with managing your inventories. So, for example, just-in-time and stockless systems. So stockless systems were sort of the craze of the 1980s, but they had reduced or faded over the years because of the difficulties it posed for the vendors. But a lot of hospitals have inventory management projects to reduce the inventory levels. In terms of technologies, some of the major technologies used are barcodes, RFID, ICTs to enable this seamless flow of information throughout the supply chain. And finally, we have the organizational structure. So of course, education is very important to improve your processes and also to have a continuous improvement department that can facilitate this continuous improvement. And perhaps one that seems trivial, but I found to be quite important and probably one of my favorite ones, was to installing a sense of pride in the employees that you're working with. So often these logistical employees, they come from troubled backgrounds. They don't perhaps really see what the point of their job is in terms of providing healthcare to patients. And often other staff groups don't really think much of them. But in one of the Danish hospitals, they had really made a huge effort to make sure that the employees actually understood that what they do is really, really important. And that had helped a lot with employee engagement. So as you can see, there's quite a lot of different interventions that you could introduce. But not all interventions are necessarily recommendable for any circumstance. So that is why some contingent factors were identified. So these contingent factors determine under which circumstances should you implement either of these interventions. So contingent factors were identified in literature in terms of logistics interventions and technological interventions. So in terms of logistical interventions, variability, product criticality, so really product characteristics and supply and demand behavior become quite important. In terms of technologies, then the network effect could become quite important. So what does everybody else in your supply chain have? Does everybody have barcodes, or does everybody have RFIDs? That might be important to consider. But those mostly have to do with the specifics or technicalities of the technologies. So if you look at the contingent factors identified in the cases, then reorder points might mainly apply to tangible items and to non-closed loop flows. If you choose to centralize some of your activities to achieve economies of scale, then you might have to face a trade-off with increased lead time or increased transport times. In terms of centralizing your inventories, that might also depend on whether other activities have been centralized, the size of the hospital, the need to control your process, what available resources do you have, and what are the financial resources you have. So for any circumstance, you should consider the legal requirements that you face, but also the financial resources that may restrict you. So in answering research question 2, a set of impact factors were identified. So these, again, relate to logistics, technology, procedure, and structure. So some of these impact factors were only identified for certain processes. So for example, environmental considerations was only identified as an impact factor for the Danish bed logistics process. It didn't really apply otherwise. But it really depends on the nature of your process. Then some impact factors were only identified for the US process and were not really validated for the Danish process due to time constraints. But then again, a lot of impact factors were identified for both the US and the Danish contexts. So each of these impact factors were ranked by the respondents on a 0 to 10 scale, asking them how important is this impact factor in terms of improving your processes. So it turned out that the most important impact factors relate to quality, employee engagement, and security of supply. So these are the main factors that impact your decision. If we then look at how could we apply these impact factors in the decision process, then first of all, you could use some kind of analytic assessment. So either by using this analytic network process method or the more simple analytic hierarchy process method, or even simply the weighted factor model. You could also operationalize these impact factors and use them as performance measures or for benchmarking, so comparing process performance. And finally, you could use them in a more qualitative or descriptive manner and describing each of these impact factors for different solutions and then compare it to what is it actually that you want to achieve for your process. And you can use these different methods in a combination, but often you would also provide an economic assessment of an implementation. So each of these impact factors somehow reflect efficiency or effectiveness in your process. So you could use them to measure or reflect either of these. So answering the overall meta-research question, a framework was developed. And this is a 6-step framework. First of all, you need to identify the subject of analysis. So what type of process is it that you want to improve? then identify either what are your challenges or what is it that you want to achieve in this improvement. So what are the benefits that you want to achieve? You can then match these challenges and benefits that you want to achieve with those challenges and benefits that can be either addressed or achieved through different interventions as identified in this study. And you can then narrow down the number of alternatives based on the contingent factors, so what actually works in your context, but also in the end evaluate them based on these decision criteria or impact factors that were identified, and then essentially or ultimately provide a decision. So this really works as a funnel in some way. So what are the contributions and practical implications of this study? So let's just revisit where were the contributions of this study. Well, again, it was across all 4 of these themes. In terms of processes, it was mainly related to benchmarking and performance measurement, but also in terms of characterizing these different types of interventions or processes. In terms of internal integration of the supply chain, contributions were also made here, and for the organizational aspect, contributions were made in terms of stressing how important these people's skills actually are in improving the processes. So what are the scientific contributions? Well, first of all, the first contribution was to give an overview of what does literature already say, so what can literature actually provide us with. Then some empirical evidence was provided in terms of how can you improve your processes. In the studies, different types of challenges were also identified for the different processes, and a catalog of interventions were provided. So what can you actually do to improve your process? A list of contingent factors were also provided to say when are each of these interventions actually relevant. Finally, a set of impact factors for the decision were provided, and this whole framework was developed. So to sum up, sort of filling the research gap in terms of business process management, logistics and supply chain management, technologies and organization in these different ways. If you look at what the practical implications are of this study, then decision makers now have a framework that they can support themselves with in a decision process. So now they have an idea of what are the challenges that I can expect from this process? How can I determine which solution is suitable for my particular situation? They understand the aspects or factors that they need to consider when making a decision, and it really enables them to make a context-specific decision. Of course, this study isn't without its limitations. So first of all, it was only a limited number of case studies that were conducted, and only for 2 countries. So you could expand the study to cover other process types and other country settings. There's a limited number of respondents in terms of quantitative data and analysis, so a larger survey could be conducted. Only the impact factors identified in the case studies were ranked, so you could also include the impact factors from the literature review to be ranked with the other impact factors. And finally, the US factors identified were not validated for the Danish setting, so that should be validated for other settings as well. And finally, this study was limited to a Danish hospital. So it would be a good idea to include a wider supply chain focus in future studies. So this concludes my presentation, and thank you for listening.
Now we will take a 10-minute break before we have the remarks from the committee. 10 minutes.
Ja.